right. Mayor President's going to make a few remarks, take a few of your questions. We also have Dr. Odenay on hand to answer your medical questions, and I have some information to put out after they are done. So, Mayor President.
Thank you, Jamie. And thank you to everyone for coming today. I appreciate that. Today, the number of COVID-19 cases in Lafayette Parish has increased to 159. Sadly, we have also officially recorded our second fatality. As we mentioned before, we will be recording additional deaths from the virus as the legally required information and notification process is completed. This is a sobering reminder that this virus is lethal and the situation is serious. I would like to take a moment to share a small slice of data that suggests our efforts, including social distancing, are having a beneficial effect. A one-day snapshot comparison from today's data shows that Lafayette Parish has administered 4,150 tests, compared to East Baton Rouge Parish, which has about double our population, who have administered 3,241. I am proud that due to the efforts of our local healthcare providers, we began mobile testing in a timely manner, and our citizens have utilized the information resources we have made available. This is a good start, but we still have a long way to go. Our 159 cases represents a 3.8% rate of positive test results, compared to a 7.5% rate in East Baton Rouge's 244 cases. While this is just one snapshot in time, our significantly lower morbidity rate is a somewhat encouraging statistic. That said, we are still waiting on results from about 40% of our tests, and we still expect a continuing increase in cases and, unfortunately, recorded deaths. I want to again encourage all of our citizens to exercise diligence and vigilance in our efforts to slow the spread of this virus. Please continue to practice social distancing, wash your hands frequently, don't touch your face, and exercise caution when you go out in public. Also, this is an important time to stand up to any social pressures you may feel to attend events or engage in activities that violate the federal guidelines and state emergency declarations in place until April 30th. When you decline these invitations, please let your friends know why and encourage them to cancel these events. It's completely up to us to determine how long this situation lasts. There's still a lot that we do not know about this virus. But one thing we do know is the more serious we take it, the sooner it will be over. Switching gears, I want to take a moment to share some information regarding a new small business loan program that can be very helpful to our local businesses and their employees. The Coronavirus Aid, Relief, and Economic Security Act, known as the CARES Act, which was enacted last week, includes a key provision, the Paycheck Protection Program, that expands the U.S. Small Business Administration's existing 7A loan program. This program provides $349 billion for small businesses to cover near-term operating expenses and to keep their employees. Applications for small businesses will be accepted beginning April 3rd, and it'll be through a commercial lender such as a local community bank. Sole proprietors, independent contractors, gig economy workers, and self-employed individuals are also eligible for the Paycheck Protection Program. Applications for self-employed individuals will also be accepted, but they'll be accepted on April 10th, again through a commercial lender. Small businesses can apply for both the Economic Injury Disaster Loan and the Paycheck Protection Program if there are different uses of proceeds for each loan. More information on these SBA loan programs, including assistance in how to apply, is available by calling 311, pressing 2, and you will speak to a LEDA Business Economics Specialist. In a moment, Jamie Angel will provide updates on our 311 call centers, our screening and testing site, in addition to other matters. I want to take a moment to thank Jamie and our communications team as well as all of the members of my staff who are working diligently and hard during this very challenging time. They're really going above and beyond, and I sincerely appreciate it. I especially want to thank their families for the sacrifices being made. I also want to thank all of our public safety personnel who continue to put themselves in harm's way to keep us safe. Our firefighters, our police officers, our sheriff's deputies, our National Guard soldiers. They're all out there on the front line for us every day. And I can't say enough about all of the brave men and women in our local healthcare community who are our real-life heroes. They work hard and expose themselves to danger to keep us and those that we love safe and healthy. I'd also like to take a moment to ask everyone at home watching and everyone here today to join us again in a moment of silence and of prayer for the second member of our community who succumbed to COVID-19 and their family. Please join me. Thank you. And Dr. Mike Odney from our Public Health Advisory Team is here with us to answer any medical questions that you have. And before Jamie gives you an update, I also have time for a few questions.
I know you said that there are some deaths pending. Is that because the test results haven't come back yet, whether they're positive for COVID-19 yet or not?
So before we can release data, and Dr. Odney can answer that when he's up here a little bit with more clarity than I can, there's a legal notification requirement before we release that information, or before the state releases that to us, should I say.
Do you see any of the testing at the Acadiana starting to taper off at all? I know Jamie's going to touch more on the numbers later, but do you see that starting to taper off a little bit?
Yeah, a little bit. Over the weekend, it was a lot slower than the previous days. Monday it picked up. Today it was a little slower than yesterday. And I think there's a lot of factors that go into that. We have other areas in Acadiana that are screening, not every single day, but Iberia. I think Erath has a screening site on certain days, Opelousas. So really is a regional effort. So very, very proud of our neighbors, but that's probably contributing to it. And again, Dr. Odney might have some statistical data that will help us with that. Any other questions of me? Hey.
Is there any update on the unemployment claims in the parish? I know last week we looked at that as a pretty stark impact on the economy here.
Yeah, no, we're seeing the same trends. I don't have the exact numbers, and we'll get with Jamie, and we can provide an update tomorrow. So good question. Yes?
Have you begun, I know it's a little early, but have you begun to think about how this is going to impact your budget next year? We're not far away from the budget process, and reality is pretty stark.
No, it's a great. Did the mic pick up his question? Okay, good. Thank you, Christian. Yeah, the very serious question, very serious issue. So we are being as proactive as we possibly can. I learned a saying in the Army: proper planning prevents poor performance, and we cannot lose sight. We cannot lose focus on being fiscally responsible with the money that the taxpayers are giving the government each year, both on the city and the parish. The budget is always front of mind whenever we make decisions, and this make no mistake about it. This situation is not only serious to our local businesses from an economic standpoint, from a fiscal standpoint, it is also extremely serious here at Lafayette Consolidated Government. But we will plan, we will execute, and we will get through this. And we will do this without raising taxes.
Do you have any information on how much money has been spent so far by Lafayette Consolidated Government on the COVID crisis?
I do not have that information at this time. We can update here in the next few days.
On the note of how it's affecting LCG, have there been any more decisions made about the city parish council meetings?
Yeah, we did postpone, or the council, should I say, both postponed their meetings for tonight. And I do not have the exact date when they postponed it to. I know we were entertaining next week, and I got a memo earlier that said that may be moved as well.
With things meetings extended to April 30th. Are they going to try and meet digitally in some way to continue the process of government?
Now, I encourage you to ask the city and parish council questions that relate to their meetings. Any other questions? Yes, sir.
In regards to the stay-at-home advisory by the governor, will there be any curfew implemented, to advise all the area people?
Right. So in Lafayette Parish, we do have a curfew for unaccompanied minors from 8 p.m. to 6 a.m., and we are enforcing that. There's no other curfew at this time in Lafayette Parish. There are other parishes that have, I believe Evangeline Parish has implemented a curfew. I don't have a list of each parish, though. Good question. Any other questions of me before Dr. O'Neill answers your medical questions?
Get the sales tax receipts. So
I can get an. That's a good question. So I don't have that information off the top of my head, but we will get with our CFO to make sure that we have an updated update for you in regards to that.
Have you been pretty successful in getting more PPE? I know that's been a big mission of yours as well.
Sure. No, great question. And again, everyone listening out there, I know we have certain offices that are closed that might have this Chris is right, very vital personal protective equipment, gloves, masks, shield, gowns are really hard to come by, and also the biohazard bags, these red bags. So to our dentists out there, to our oral surgeons, or to anyone in the healthcare field or anyone with personal protective equipment, please consider, and I strongly urge you, to donate it at the Cajun Dome screening site between 8:30 a.m. and 10:30 a.m. or right behind me, and I don't know if you can see it, but there's a box back here at LCG at Lafayette City Parish Hall that you come by and you drop it off during business hours and you can log in your donation. Not only does that help our frontline warriors, our healthcare providers, but it also helps our taxpayers whenever we go to get reimbursements, and our chief financial officer can elaborate on that a lot more than I can. But it helps, so good question, Chris.
Have you all been able to actually purchase any? I know a lot of people are still struggling with that, and even if they are able to order it, it's taking quite a long time to be able to get in.
I know we were able to order face shields with the emergency funds that the parish allocated. I don't have the exact amount, and I'm unaware of any other PPE that we were able to. I'm sure we have, and that's what the money's there for, to help out our frontline healthcare providers, to help our people.
I know you said the promptness of getting the Cajun Dome screening site up and running may have contributed to this lower rate of positive tests. Is there anything else you contribute the data you gave us today?
Sure, and our good doctor can elaborate a lot more on medical information than I can, but I think I can speak for all of us when we say the front line of defense is not with the government. No matter what we do on the government side, the front line of defense starts with us. It starts with you and I, social distancing, washing our hands, implementing common sense measures to our large-scale retailers, to our businesses out there. I see a lot more of our businesses implementing the one person, one buggy rule. I think that's very wise. Trips to the grocery store, all common sense tactics that we've implemented here locally. Starts with the family, starts with the individual. But going to the grocery store once a week as opposed to once a day, going with one person as opposed to the whole family, one person, one buggy. 6 feet social distancing. Continue to exercise these very common sense but very important measures. I know you hear this, and everybody listening at home, I know you hear this every single day, but that's good because you can't hear it enough. I can't hear it enough. We can't implement this enough. We're doing a good job, Lafayette. We're doing a good job, Acadiana, and my fellow parish presidents will echo that. But there's so much more there's so much more of a longer path that we have. But that front line of defense, it starts with you and me. Yes. Hey.
Hi. Okay, so like you just mentioned, it all starts with every one of us doing those social distancing things of that nature. I know a lot of smaller communities like Lafayette have implemented things like limiting the amount of people that can go into huge stores like Walmart, support smaller local groceries. Is that something that can possibly be implemented here in Lafayette Parish? Right,
and we are implementing it. It starts with the local businesses. We had our sheriff here yesterday to talk about law enforcement procedures. We do have our chief. Yep. Our chief of police is here. If you have any law enforcement questions, I'll ask Chief Morgan to stick around so that you can answer he can answer those questions. But places like Academy, for example, and that's just one business off the top of my head, have implemented the 10-person rule, and they literally are counting out there. So I think that's a very common sense tactic. Our governor and our president has been very clear on the information that they've given us, and we've been pretty clear here locally too. First line of defense starts with us. Social distancing works. So with that, I will turn it over to Dr. Odnay. Again, I want to tell you how much I appreciate the service that you're providing to our neighbors. Today is a grim day because we confirmed the second death to this very deadly virus. But again, to all of our neighbors out there here in Lafayette and to Acadiana, we will get through this. This is another example of a natural disaster. It's a natural disaster that we've never seen before. It's an enemy that you can't see. But we are Lafayette. We are Acadiana. We're Louisiana. And we're Americans. We will get through this. God bless you. Thank you, Doctor.
Hi, how are you? Questions?
Yeah, Doctor, one of our viewers reached out to us and had a question about if they received the flu vaccine, how immune are they to potentially getting the coronavirus? Is there any protection there?
No, we don't believe there's any protection. There are different viruses altogether.
So my wife, she works in the New Orleans area as a nurse, and one of the things that she's mentioned at her hospital she's at is the lack of gowns and how they're having to share with other nurses and doctors. Are y'all seeing that here in the Acadiana area as a problem just yet?
No, not right now. We're not seeing that, but if we get a significant surge, certainly if we get a surge even proportionally to what New Orleans has, that could be an issue. But we're trying to prepare for that. The city and parish is working at every turn. They ask us every single day what we need to make our community successful from a hospital standpoint, and they're really pushing hard for us to get those things.
I had a viewer ask, there's no way you can really treat coronavirus, but is there any sort of medication people can take to sort of relieve the symptoms if they feel like they have them?
So we recommend that you have a well-balanced diet. First of all, get enough rest, and if some people advocate taking vitamin C. That's a routine vitamin that I think that is good for everybody to take. But there's no medication, no prescription medication that we feel like is going to protect you from getting coronavirus. No.
Are hospitalizations continuing to increase? Are you seeing more people come into the hospital?
We're seeing a steady flow. For me to say increase, I don't have those exact numbers, but we're definitely seeing a percentage of coronavirus patients.
And sort of a quick follow-up on that, the Mayor President just said we feel like there's a snapshot here that shows to some extent flattening of the curve, or perhaps like at least some glimmer that social distancing is working. Is that bearing out in your immediate experience?
So I think by the numbers that he gave you earlier, I think that we can see some of those things come to fruition, right? Our numbers are by percentage are obviously better than what we see in our counterparts in Baton Rouge right now. So we definitely want Acadiana to keep doing the things that we've been advocating as far as social distancing, proper hand washing, and things of that nature. Yes, ma'am.
I'm pretty sure you probably can't tell us about how many of the... Okay, so I'm pretty sure you probably can give us a more concrete number of how many, the gowns, the plastic masks, the PPE masks, and all that. But just where we are right now, do the people on the front lines have enough?
Yes, today we have enough.
Do they have enough to kind of change it out like they're supposed to before they go to every room?
Correct.
Okay.
As appropriate based on the clinical setting, right?
Correct.
Okay.
Well, could you kind of answer this? We was able to speak to a nurse out here that's on the front lines in a corona unit out here, and she says that she's having to wear one mask all day.
I'm not aware of that situation. I don't know where. I can't speak for that if somebody else said that, so I don't have any information on that.
But to your knowledge, everyone in the facilities out here, they have what they need to.
At the facility where I am, I can assure you, and I speak on a regular basis to the other facilities and the people working on the front lines there, and we are adequately staffed with PPE at this point.
Being at the Cajun Dome, volunteering there, would you say we are seeing less people from surrounding parishes as they've begun to open testing sites?
I would say the volume's less, but I wouldn't say, because I really don't know where they're coming from. I mean, and I know in the beginning, just as the cars pass by, you notice out-of-state license plates for that matter. So I don't know if they have an out-of-state license plate and they're a Louisiana resident. So I'm not sure where everybody lives, because on the screening side, from the medical doctor side, we do the screening, whereas we capture the clinical signs and symptoms that you're having and approve you to be tested, or what we call screen you out, that you don't meet the criteria set at the current time to be tested. So I don't have the where these people are living at the time. But that data is captured from the screening sites at the time of screening, yes.
And I know we asked the Mayor President, he said that there are deaths sort of pending. Would you say that's because some of these tests are taking, a week or so to come out, and we're testing some of the sickest of the sick at the Cajun Dome?
Well, I think there's a process, right? When you're talking about reportable diseases, there's a process to go through, and we don't have the answers yet. So certainly we don't have that data available for the media. But as soon as that data comes in, family notification, we figure out exactly what happened, that data will become available in time.
Two more questions.
We've asked this a few times, just to kind of check in again. Do you expect that we should see a point in which testing criteria is lowered, so we're testing more people?
That's correct. So as test availability come online, then we'll test more people, and the criteria will be changed.
I guess I'm asking, have you gotten any indication that it's coming sooner than later?
Well, that indication, as we talked about, there's lots of PPE out there, but getting a hold of it, I think one of you guys asked a question. So we know that it's coming, but when is it coming to a community our size? I think that's yet to be determined.
A couple of people questioned me about this. Local physicians, at least two, requiring patients to go into the office for routine prescription renewals. Like, you have an annual thing, and they're like, why do I have to go in? Should they be doing that?
Well, I think that, the restrictions as far as HIPAA are concerned, have been relaxed so that physicians can utilize a platform like Skype or a telemedicine or even a FaceTime to be able to accomplish those things. I can't speak for what exact prescriptions and what's necessary to be able to rewrite those. Sometimes you absolutely need blood work to have a certain prescription filled, because we need to know where you stand based on your lab work in order to take that. So, thank you.
All right. We're going to go through the numbers real quick. Again, Mayor President talked about the positive cases, 35% jump from yesterday going. We have 41 new cases in Lafayette Parish. In other parts of Acadiana, total COVID-19 cases, 362 with 9 deaths. Cajun Dome screening site update, 72 people at the site today. 20 were screened out, 52 were tested for COVID-19. That screening site opens again tomorrow morning from 8:30 to 10:30. 311 update, real quick update too on our meals that we gave away today. 450 meals, they went in about 30 minutes. So no longer are we going to say that the time is from 11 to 1, and more realistically, it's about 11 to 11:30. But again, targeted to those folks who recently find themselves unemployed or underemployed because of COVID-19 in the retail, services, hospitality, those types of industries. We'd like to help you out and come on by. Thanks to the Breeze Dream Foundation. We're going to continue to do those for the next several days, and we'll keep you updated if and when we have to make some adjustments to that. So again, we had cars lining up as early as 10:30, 10:45 to where we had to open early because it was starting to cause backups on the Eras Landry. So got to get there quick. Let's see. 311 update yesterday. Medical staff answered 317 calls. 38 people were sent to be screened at the Cajun Dome. 20 calls were non-medical related. 26 were for general COVID-19 questions. 17 people sent to their primary care provider. 3 sent to the emergency room. with 17 sent to urgent care and 24 instructed to self-isolate at home. Our LCG LIDA call center, that continued today with LIDA staff answering calls through our 311 call center. 11 members of the staff were answering those calls and helping business owners. We handled 51 calls today. That's a bit of a drop off from yesterday. But again, I think we've answered a lot in the first few days. We're going to see those numbers drop off a little bit once everyone who wants those answers gets those answers. 19% of the people were asking for guidance on SBA loan information. About 54% of the callers needed unemployment insurance information. 31% of calls were from business owners, and 63% were from employees. The call center is open again tomorrow from 10 a.m. to 2 p.m. Dial 311, then choose option 2. And if you call aside from those times, you will be directed to an answering machine where you can leave a message. But we encourage people to call between 10 a.m. and 2. And again, if you want a physical packet, you can come over here to LCG headquarters, City Parish Hall, 705 West University, and you will be given some of that information. And that, again, that's from 10 a.m. to 2 p.m. Let's see, funerals. There's been some concern about how funerals have been conducted recently. We've had a lot of calls here about large funeral gatherings. Yesterday, the governor clarified that. He established an order saying that 10 people are permitted at a funeral service, both in the funeral home and graveside. That's 10 people, including funeral home staff. So limit that to immediate family. Graveside services, same thing, 10 people are permitted to attend, rather than the standard practice of several funeral directors, staff, clergy, pallbearers being present. Funeral directors have been instructed to limit non-family attendees to essential personnel only and follow social distancing guidelines at all times. It's a very tough situation to be in. Nobody really wants to hear that, but again, it's to keep us from having to have more funerals. So today is Census Day, in case you didn't know. The deadline to complete your census is coming up. So online, 2020census.gov or 844-330-2020, 844-330-2020, or 2020census.gov. This is the first time you're able to actually complete your census online. That's important not only for population count, but it determines the number of representatives Louisiana will have in the U.S. House. We were talking about the council. Chris, was it you that had a question about or you did? Neil, what was your question again?
Have they discussed meeting digitally?
Right, they have. They are working on that. They're working out those issues, and I know Attorney General Jeff Landry also issued some guidance as far as allowing the media to be involved in that as well. So a plan is being worked out. I can't tell you if it will definitely be rescheduled for April 14th, but we've been in contact with the council and the council clerk, Ms. Veronica, so it's being worked on. I am confident that they will be able to work something out in the next few weeks, and we'll be able to carry on with our operations. But for Lafayette City and Parish citizens, government business is continuing, and council members are available to you and waiting for your calls if need be. If you want to contact your council member, call 291-8800, 291-8800. They still represent their constituents, and they still work for you guys, so by all means, if you have some issues, reach out to them. Lafayette Parish School System has asked us to update parents and caregivers of Lafayette Parish Public School students. Today is the absolute deadline to register for meals to be delivered to your home. This new system is replacing the grab-and-go lunches children are currently picking up, but you must apply to be part of the new Meals to You program. Again, deadline is today. It's the only way to receive those meals at your home for your children. This applies to students who receive free or reduced lunch. They do qualify for the program, and students who attend CEP schools in the district. A list of schools can be found on the website, lpssonline.com. And for local vendors and suppliers, again, we encourage everyone, if you can, to shop local safely. Use local vendors if you do have a place that requires vendors. They are looking for local vendors and suppliers for that Meals to You program, and they're accepting applications to supply those meals. Interested vendors and suppliers can find the application and the requirements on the LPSS website. Again, that's lpssonline.com under In the News section. A little update surrounding parishes. St. Martin Parish is instilling a curfew. Begins at 10 p.m. tonight and goes until 5 a.m. in the morning. And that will be every day. Of course, essential workers, employees that have to be on the road, government officials are exempt. Just make sure you have the proper paperwork and whatnot that you need. With that, any questions of me?
I have a question for Chief.
Chief.
If we can get Chief.
Chief loves answering questions.
Chief, so many of our viewers have been asking, why is Hobby Lobby still open? Hobby Lobby shouldn't be classified as an essential business, they're saying. Have y'all received any complaints, and if so, are y'all planning to ask them to close?
Ironically, I knew you would be asking that question. So I can tell you this, we don't determine what is open or what is not open under those criteria. We just see if they fit in that criteria, and Hobby Lobby does fit under one of those circumstances, and that's the reason we haven't closed it down.
So they're classified as an essential business.
Under, I can't quote the number again, but yes, under one of the clauses, they supply materials that would be considered essential.
Have y'all received a lot of complaints about them as
I know of two. That's the only two I know of.
Can you specify what materials? I mean, you're talking about fabric materials or?
Fabric type materials, yeah, stuff like that. Sure, there's others. There's going to be other types of cords and things like that, but some of that material can be used to make masks and other clothing and materials, yeah, scraps and stuff like that.
We're glad you
Scrubs.
clarified so we can quick in the Facebook messages.
Any other questions? Or is it being on?
I know Jamie spoke about funeral concerns. Have the police department heard any of those or had to respond to any large funerals?
No, none that I know of as far as funerals go. I think most of those circumstances are organized with the funeral home organizers, and they will put those things in place to where they're not violating any of the orders. They're there to work with us as well, but we haven't had any complaints for that. Thank you.
Sporting goods stores?
I'm sorry?
Why sporting goods stores are open?
Academy type sports, I can't tell you exactly what clause they would have fallen under or would fall under, but it would be under one of those that are issued through that. They would have some type of essential type material or something that they, and yes, it would be different things, and you got to understand that sometimes when you list a business on there, we have several businesses, especially in the Lafayette area, that sell multiple types of things. They're not just a restaurant; they're a convenience store. They sell fishing supplies. It's that type of community that we live in. So some of these cases with bigger stores will sell one or two of those items that would be considered essential, and you have to try to be somewhat fair with other stores that may sell nothing but that material, but these sell as part of their business.
Chief, do you have any information on if y'all are trying to hold off as much as possible on arresting or detaining minors during COVID-19?
You talking about for the curfew thing?
I was just asked to ask you if y'all are holding off on the arrest of minors during possible COVID-19.
We're not holding off on any type of arrest, whether it be juveniles or not. There are some circumstances where we will, if we don't have to put someone in jail, if we can issue a summons, we will go that route. I wouldn't say that we're doing anything different with juveniles. Either the facilities will take them under the circumstances or they would not. But we still have the obligation as law enforcement officers to do the investigation and make the arrest.
I know that, correct me if I'm wrong, there is a curfew in place for minors, and of course the stay-at-home order from the governor's office, 5 be home by 5 o'clock, that sort of thing. How are you all enforcing that?
Talking about for juveniles? The juvenile curfew, is that what you're talking about?
Yeah.
So if we have a child that we find in violation of that, we would treat that just like any other violation of curfew, the regular curfew. They're issued the same type of forms. We get in touch with the parent, and that the parent and the child are both responsible for going to court on it.
And
So we would issue.
for
Yeah.
the state mandate, the stay home 5 o'clock, are you guys like enforcing that as well out here? That they're not essential employees?
I don't know of any that we have here. We don't have one that's
No, I think
for Lafayette Parish.
What the state one says is that local governments have the authority to put in place some of those things. I don't think it explicitly says, we'll go back and look at that. I don't think it.
Well, that may be a question for you. Is that something you guys are gonna put in place, maybe here, like just in the parish, to kind of limit the people being out at
At the
time?
moment, we have no plans.
Thank you.
Yep.
Yeah, Leah, to answer your question, it was about further curfew. At this point, there are no plans right at this moment to implement any additional curfews. We're not ruling it out completely for the future, but it's an option. But as of right now, none of that is in play. Can you tell me what specifically you were referencing about the 5 o'clock?
No, I'm just saying, like, maybe I got a mixed up with, like, the statewide, stay at home order, 5 o'clock,
Okay.
yada, yada.
I don't know if maybe he mentioned something along those lines in his press conference earlier. I didn't get to watch it. But. Go.
Just checking on an update. Have you got any sort of further clarity on the HUD money, what you guys are going to do with it?
I have not gotten clarity on that yet.
And
And it may be a little bit.
I'm just going to bug you about it.
I would expect nothing less.
Secondly, I understand there's been some question or calls for concern about folks who maybe don't really understand where their rights are in terms of whether or not they can be evicted, whether the governor has issued
Yes.
no eviction order. You guys, I understand maybe you guys were trying to make sure we had some clarity on that. I mean, did you get any clarity that
From what I understand, we are double checking with our city attorney, but at this time, you're not able to do evictions. Number one, the courts are closed, and there is some legal steps that need to be taken in order to evict someone. So no, you should not have landlords going in, taking stuff out of your home. Same does not I'm not sure if the same applies to hotels. I'm still trying to get a definitive answer on that. But as far as
exactly how that works?
correct, and I'll say this honestly, it's not a very good time to be evicting people. I mean, all of us are hurting. People are losing their jobs out of nowhere. Might be a little insensitive for folks to start putting people out in the street.
What about rent and utilities? Like, would they still be expected to be on time, or would there be late fees applied?
There's always an expectation that you pay on time if you can. As far as late fees, when it comes to that's on the specific properties. But I would assume that most leases carry late fees written into them. As far as utilities, again, as far Lafayette utility system, on March 13th said 60 days, no disconnects, waiving of late fees. That is still in effect. And you notice that 60 days goes beyond April 30th. But again, if you can pay a little bit, because what's going to happen is if you are out of work for the next 2 months, you're still racking up these bills, and you might still be out of work when this is lifted, and you're going to have large bills to pay, and they will eventually need to be paid. So try to pay what you can when you can.
Jamie, you might not have this information. This might have been a question for the doctor, but somebody had just messaged me and asked, do y'all have any hard numbers on how many people are hospitalized here in Lafayette Parish with COVID-19?
What's that?
On the LDH site.
Right. I think it's on the LDH site. Double check. I know in the governor's briefing he did have some of those numbers. I can't tell you the exact number by region, but when I get back to my office, I'll see what I can find out.
I know the station, they've been really good about updating that number. This question just came in to me on Facebook.
I can tell you there's quite a few. The exact number, I'm not sure. There's more so suspected cases at this point, awaiting confirmation. But that's going to be the trend for a while. Andrew.
For the meals today, any plans to expand that? There's clearly a big need.
Right now, we're going to understand this is not our money that we're using for this. This is graciously donated by Drew Brees and his foundation. We are trying to make that last as long as we can. But again, that will end at some point. We don't want to just go through it all in the initial beginning. We want to try to be able to help some of those folks. But again, we do ask, if you are receiving other forms of assistance, SNAP benefits, Louisiana, I'm not quite sure, I guess that's SNAP benefits, food stamps, things like that. Even if you're starting to get some of those unemployment benefits, we ask that you maybe hold off if you don't have to take one of these meals that someone who's not getting any benefits right now can use. We would appreciate that. And there is a limit to 2 per car because we just have so many people coming through. We're trying to help as many people as we can. So
Still working on the honor system.
yes. And we want to continue to do that. So we again ask that people try not to abuse it.
We're looking at 450 for tomorrow.
That is correct. Last I heard was 450 for tomorrow. So don't be alarmed if you get there at around 11:20, 11:30, and we don't have any more meals to give. So fortunately, they go quick.